On behalf of Roger and everybody here at Line, I want to thank you for taking some time this afternoon to take a journey through the implications of this coronavirus in the workplace. As Roger had mentioned when you came in, you should have a copy of your reference book handy in front of you. That will be useful to go through, because all of the slides that I'm going to show on the screen as we walk through this afternoon are going to form the basis of your reference book, so you can simply follow along and add additional notes or action items if you would like, and so that way it makes it easy for you to follow along. If you haven't gotten it, take a look in the chat window. Roger has sent a link to where you can go to print that out. So as we kind of journey through in this the first hour, we'll spend a little bit of time just to talk a little background to make sure that we have some of the foundational information available, and then we'll start taking a look at, from a workplace perspective, what are some of the things that as an employer we should be addressing or considering as we try and tackle safeguarding our workplaces, especially in light of infectious diseases such as this COVID-19 in particular. So let's dig in. Let's take a closer look. And we'll start first and foremost, we hear this term coronavirus, so just kind of making sure that we're all on the same page. When we refer to, or you hear health officials referring to coronavirus, just as a generic term, that is just a term that is applied to a very particular group of viruses. And these viruses as a whole tend to target respiratory tract in living organisms, and there's a lot of different coronaviruses out there. In fact, this created some confusion when early on COVID was making the news and such. In fact, one strain of the coronavirus is associated with the colds that we might experience from time to time seasonally. Rhinovirus is the predominant type, but there are coronavirus strains that can give us the common cold. Coronavirus as a group of viruses is also known for some of the larger recent infectious outbreaks. The SARS outbreak back in 2003, and SARS is short for severe acute respiratory syndrome, and also for the Middle East respiratory syndrome, or MERS outbreak, and there's been several of those. But behind each of those different diseases, there has been some strain of coronavirus. Now, you've probably also heard, as the news and as the health officials have talked about this, or you've gone to agency pages like the CDC, sometimes you'll hear the term novel virus or a novel strain. And when we're talking about the specific pandemic that we're dealing with now, which is named coronavirus disease 2019, or for short, COVID-19, that's where that acronym comes from. The term novel simply means, from kind of this science background, that this is a particular viral strain and impact disease that hasn't previously been identified in humans. So at some point in time, this virus that causes the COVID-19 disease jumped from another species into humans. And so therefore, when it first was identified back in late 2019, primarily in the Wuhan area of China, that was kind of the first time that this particular strain of the coronavirus was identified or noticed in humans. Now, one of the other things that you might hear from time to time is So you might hear this expression. If I can get this up on the screen for you, SARS-CoV-2, if I'm pronouncing that correctly. And sometimes it appears like COVID-19 and SARS-CoV-2 are interchangeable, but actually they're in the science world, in the health world, they're referring to two different things. COVID-19 is the name that was identified by the World Health Organization for the disease itself. So as patients come down with this respiratory disease, the term COVID-19 is applied to that. The actual virus, the actual coronavirus strain that causes the COVID-19 disease has its own name, the SARS, which again is the severe acute respiratory syndrome coronavirus, COV-2, not to be confused with the 2003 SARS virus. So it actually has its own official name. A little cocktail trivia for you. The World Health Organization names the disease COVID-19, and it's actually an international body called the International Committee on Taxonomy of Viruses that actually comes up with the name of the virus. So you can impress your friends at the next social gathering whenever that might happen, but that is a distinction. So if you do see those two terms, understand that's what they're referring to. So as we take a look at COVID-19 as a disease, and we look at what do we see, we said it's a respiratory disease. One of the things that the health officials have indicated is that the degree of severity of this disease, in other words, the symptoms that a particular person that's infected with the SARS-CoV-2 virus is going to experience can be vast, far-reaching. If we see common symptoms, they'll include things like fever, cough, shortness of breath. That's not a surprise if we're saying it is targeting the respiratory tract. But they do vary in terms of their severity from one patient to another. On the severe side, which is what we're hearing a lot about, and these complications can be pretty significant and taxing on the healthcare system, we can see patients that will develop secondary health effects like pneumonia. We can see organ failure beginning, multiple organ failure, and then in some cases, that can result in death, fatalities, and we've certainly seen these in larger numbers than we've seen with other types of viral outbreaks, for sure, and on a global scale, fairly significant. Now, I said that the symptoms can vary very widely from that severe end to even in some cases patients that have the virus but are asymptomatic. In fact, there was a study not too long ago that was in the news and in Iceland where they were compiling their test data. They were showing that there was a rate about 50% of the people that they tested that tested positive were people that were asymptomatic. They didn't have any of these symptoms, no fever, cough, noticeable respiratory ailments. And that's pretty significant because those patients still have the disease, still have the virus, and still can be transmitters of this. So it adds an added layer of concern and caution that we need to be aware of, not just socially, but also, again, as we start to bring that down into a workplace setting, it complicates things for sure. Obviously, you've heard in the news there are susceptible populations where we'll see the likelihood of the more severe symptoms occurring, and as with other respiratory viral diseases like influenza, we see some commonalities there. Older individuals, CDC talks about individuals that are 65 years or older are certainly at a higher risk for the more severe, as well as folks that have various types of chronic health conditions. You see a couple on the slide here in terms of heart disease and diabetes and lung disease. This list goes on as you look at CDC's website. It could include folks that have moderate to severe asthma. It could include persons that have some sort of immunocompromised condition that could be a result of cancer treatment. It could be smokers who are sometimes have a weakened immune system, individuals with HIV/AIDS, bone marrow or organ transplant individuals. These are folks who, even on a temporary basis, potentially have some immunosuppression and could be at risk. Severe obesity, BMIs of 40 or more, they've seen in the higher range of these severe effects, and even liver disease and more. So a large number of susceptible populations. And again, we think about it from a workplace setting. We could have individuals in our workplace who generally healthy but are in some of these categories that could be at a higher risk of, if they contract the disease, suffering the more serious sides of the illness itself. Now, this is a moving target. A lot of this information is changing on a moment's notice, so we take it for what it's worth, a grain of salt, a snapshot in time. As we were finalizing the slides for today's presentation, these are some of the CDC statistics, and you can kind of see that unless you're talking about some of the U.S. Pacific territories, just about every state and every territory has at least some cases of COVID-19, and we have a high death result from this. In fact, this has gone up significantly in just a very short period of time, as many of you have probably seen. Just a side note, when we drafted the presentation a couple of weeks ago, just 2 weeks ago, and putting in this placeholder slide, the March 31st data from CDC showed that the total U.S. deaths at that time were just about 2,800. So it's a tenfold increase in these cases and these deaths in just 2 weeks. So we've heard a lot in the news about the curve and flattening the curve and such. So it is something that is a big issue. Now, as we take a look at our workplaces and we look at how do we address protecting our employees from these types of situations, in this case COVID-19 or any sort of infectious disease outbreak that we might encounter in the future, we can look to some of the things that we've been hearing in the news a lot lately, that these kind of general precautions. These are things that are health professional recommendations that some of us have been hearing for years when it comes to flu season, but can be applied effectively in these current situations as well. And whether we're talking about our homes, our private lives, or our work environment, we still want to address these and implement them where we can. And of course, the first in these general precautions is that constant reminder of how effective frequent washing of our hands are to minimize the spread of the disease. Again, this is nothing new. We hear this. It becomes background noise probably for many of us prior to this pandemic. We hear it when we're dealing with flu season. If you've traveled in the last couple of years, with outbreaks and cruise lines prior to this pandemic, a lot of the cruise lines have stepped up their efforts to encourage passengers to wash hands. So this is something that can be very effective in tamping that down. There's all sorts of guidelines, minimum of 20 seconds with soap. If you don't have access to soap and water, then hand rubs that have at least 60% alcohol is what the CDC is recommending for use. And so we want to be mindful of those as we can find those supplies. Again, some of the other general precautions. And so as we think about these things, how do we communicate this and make this ever present in our workplaces? The reminders of not touching our eyes and nose and mouth where our mucous membranes are, so that if we're picking up this virus from surfaces, that we're not introducing it to our mucous membrane areas where it can enter into our respiratory system. Social behaviors like maintaining safe distances, and you hear this 6 feet or more. We see it more prominently if and when we go out in social settings. The idea is that because this is transmitted in aerosol form, we cough, we sneeze, we speak, that viruses in those little aerosols, they tend to be airborne for about 6 feet as they leave a person. So maintaining that distance is important, and how we set those up in reminders in our workplace are important. Coughing and sneezing into our elbows, we learned good manners years ago to cover our mouths, but learning that a lot of these respiratory diseases get on our hands, and then we can introduce them to our mucous membranes and then infect ourselves. So coughing, sneezing into our elbows as opposed to our hands. Encouraging employees to stay home if they're sick. And this is sometimes a battle. We deal with this all the time. Folks, for various reasons and motivations, coming into the office when they're not feeling well, whether we're talking about the common cold or others. And obviously in the case of COVID-19, more serious effects if we have employees. So stepping up our efforts to encourage employees. And there might be fear factors there that we have to address as employers, that employees understand that the reason is for their protection, their employees' protection. Should not be fear of them losing their job and such, as we try and encourage that. Self-quarantining 14 days tends to be the period of time from exposure to potential showing of symptoms of the disease. And again, that's further troubled by the fact that 50% of the people might be asymptomatic, so it's really okay if we have symptoms. But how do we manage this where we have employees that might be in contact with others who are confirmed positive for the disease? Kind of going back and looking at all of their social contacts and trying to restrict access gets difficult. General precautions continue in terms of cleaning and disinfecting our surfaces, including surfaces in our workplaces. If folks have the virus and they do cough in their hands, or they get it on their hands and they touch surfaces, or they cough onto a surface, that virus can live outside the body for many days in certain cases, depending on the surface. So a rigorous cleaning, disinfecting protocol is something that we want to look at, and maybe even consider, do we increase the frequencies? And the materials that we use. Bleach solutions are effective. You can make your own. You'll see there a little recipe, the ratio of the amount of bleach to water, to make your own kind of cleaning solution. Alcohol solutions, 70% or more is a recommendation if we're using an alcohol-based cleaning solution. The last bullet, I want to talk a little bit about that. And CDC certainly encourages use of commercial products that might be identified for this. But the important part is that whatever products we're getting, we need to make sure that, one, they're EPA-registered products. There is a law that EPA implements that deals with various types of pesticides, including products that are intended to kill various microorganisms, including viruses. And those products have to be registered with the EPA, and there's labeling information. You can go to EPA's website, their pesticide section, and they have a whole bunch of lists of registered pesticides. Specifically, you want to be looking for products that are on the list N of emerging viral pathogens. Those products have specifically been reviewed, vetted, and that includes coronavirus types of household or commercial disinfectants. With every type of outbreak, there's always folks that are trying to enter the market with products, and those products not necessarily being registered. There's no check to make sure their efficacy. So EPA has recently been stepping up enforcement against suppliers and vendors trying to sell these unregistered products. So very easy. Go to EPA's website, look for your product on the list N to know that you're dealing with a product that has been at least vetted and hopefully effective for cleaning, disinfecting surfaces with coronavirus. Now, as we look specifically in some workplace areas, again, a lot of these come over from some the general social stuff. As I take a look at these slides, I know that many of you joining today are probably dealing with a lot of the government initiated stay-at-home orders already. So a lot of stuff that we kind of talk about in general, you may be doing and doing to large extremes, and some of that is implemented by government entities. Our state of New Jersey, where we're located, has had a stay-at-home order for non-essential employees and businesses. So many of these things may not be pertinent right now, but at some point in time, those will be lifted as we deal with that curve. There may be different times for each of you, depending on where you are in the country and what your local governments or state governments say in terms of that. But one of the things to be mindful of is that even when those restrictions get lifted and life begins to return to normal, one thing that's important is we've been talking about that flattening of the curve. Be mindful that that curve doesn't instantly drop to zero when the government lifts the stay-at-home restrictions.
What's wrong with you doing that?
We have some phones that are not on mute, so just double check and make sure that your phone lines are muted, so background noise is not going to interfere with folks here. So as we start thinking about going back to work and back to normal, these are things that we're still going to have to address moving forward for maybe an extended period of time. You know, the curve doesn't go down to zero right away. The virus still exists. We don't have a proven and distributed vaccine. So this might be something that our businesses have to continue to address for the foreseeable future. So as we start returning to normalcy, some of our workplace social norms may have to be addressed. Obviously, a common cultural thing is handshakes for greetings. Do we continue to stop that type of practice for the foreseeable future? I'm not advocating we do elbow bumps. I'm fine with a wave, a bow, whatever it might be, but do we continue to stress changes in our social norms as we get back to work? Again, looking at our cleaning and disinfecting practices for the foreseeable future. What's our historical cycle been for cleaning and disinfecting, and will we need to continue to see an increased rate at which we clean those surfaces, desks and common area counters and bathrooms where various employees' hands might be in contact, doorknobs and the like. Continuing to encourage and communicate good behaviors, good disease prevention behaviors. Again, things like instruction on how to properly cough and avoid touching your face and such, especially during these cold flu seasons, COVID or otherwise. And we've talked about this before, encouraging our employees and assuring our employees that it's okay that if they're sick to take a day off, to take and use their scheduled available sick days. By doing that, they're helping themselves as well as the workplace kind of keep things at bay. And so companies have to look at how do we change the communication and step up the communication as well as our practices in these areas. And we still want to consider things like work from home options when possible, especially during periods where exposure risk is still high, perhaps. And of course, that creates all sorts of other potential concerns, namely from a workplace safety setting. Certainly, I'm sure folks are considering, well, what are the obligations that we have as employers under the workplace safety laws to assure this? And OSHA has addressed this a number of years ago. Actually, it's 20 years ago now. They came out with a compliance policy letter on work from home. If you want to jot down the number, you can go to OSHA's website and look at it. It's a fairly short enforcement document, 2-0.125. It came out in February of 2000. And it basically says that, well, obviously, employers have a general obligation to assure safe workplaces. They are not requiring employers to inspect employees' home workplaces. And at the same time, OSHA is not, as a general rule of thumb, going to be inspecting home offices for compliance with standards. Now, there are exceptions to that if it's a home-based business, if you're doing some sort of manufacturing type of activity at home. But if it's a home office, you're working from home remotely, there are not going to be obligations that the employer has to physically inspect these places, and OSHA is not going to inspect them. There's still going to be obligations. It is a workplace, so if you're subject to injury, illness, record keeping, and reporting, workplace-related injuries in the home, it'd still be something that we'd have to consider for record keeping, but at least from a standpoint of are we given some special obligations that we have to address? We certainly still want to take reasonable steps to assure that our employees have safe, comfortable work environments if we're going to let them do that. I know even in our work setting, there's some self-assessment checklists that we have for employees to assure they have a comfortable, ergonomic workplace to do the work during the business day. And so something to work on jointly with your employees as you work through that. And so you certainly want to address that. And one of the other side effects of this, and especially in heightened stages of work from home, is assuring that we're doing what we can in terms of communication with our employees about maintaining effective, healthy home life, work life balance. Very easy for employees that are working from home to kind of work on a 20-hour day, and that's not necessarily healthy for them either in the long term. I know that my wife's company has been really stepping up the communication as they have their web meetings and encouraging folks that they need to make sure they have time off from work while they're working from home. So those are things that are important as well. As we continue looking at things like meetings, in-person meetings, especially for the foreseeable future, as we start, even when we start getting back, right now it's easy for a lot of us. We're doing nothing but web meetings, but what happens as those restrictions are slowly loosened, but we still have the virus out there. We still have people susceptible to serious effects of the disease without vaccine. Evaluating what meetings are important versus non-essential to minimize exposure. How do we set those meeting environments up if they are in person to help assure good social distancing for the foreseeable future? Can we use technology in some of those cases? And there's all sorts of systems out there, whether you're talking about Zoom or or Microsoft Teams or Slack, or there are ways to continue to do business without necessarily being in person for all that aren't essential for us to be in person. Things that we need to continue. If you are in a place that deals with food service, cafeterias and such, guidelines from CDC, things like limiting food sharing, maybe stepping up some of the general precautions, surface cleaning, hygiene, screening workers and such, so that that we minimize the impact to that. We think about travel. Obviously, travel right now, as we've said, is probably fairly limited. But again, as you start thinking about ramping up to business, things that we're going to have to continue to evaluate in terms of our travel planning as companies. The best advice I can give is that we need to maintain as much flexibility as our business operations permit. There's not going to be a magic time frame for when business travel will be unfettered like it was prior to the beginning of this year. And so things that we need to take a look at as we move forward in terms of determining when is travel safe and when is it acceptable. Some things CDC has even thrown out in terms of factors to consider, looking at where are our employees going to? What's the condition where we're sending our employees? We might be fine in our area, our neck of the woods, but are we sending them to an area that's still a hot spot? Or what if a client is requesting us to go to them and they're okay there, but maybe where our employee is traveling from is still dealing with a high number of cases. So we're mindful of, are we going to have our employees be carriers to areas that are not as widely affected? What do our clients have in terms of added checks and controls? One company I was talking to, they have kind of stepped up their travel protocol so that there's a committee or a group, a team within the company, obviously company size will show this differently, but that approvals have to be done, and now they're addressing what criteria that team or group looks at in terms of approving travel. So there may be more restrictions you want to put and take a little autonomy away from your employees. And other factors, are our employees going to be in close contact when they're traveling? Are the employees themselves in a higher risk category that we talked about earlier? And again, we're careful. We don't want to send them someplace where they can have this added risk of contracting the disease and having some of the more serious effects of this. Or do they have persons in their home life or back in the office team who are in that? So again, they come back. What do they do when they do come back? What practices do we put in place? If they're coming back from areas, do we require them to stay home for a while? So these are things that we're going to have to be considering for the foreseeable future compared to our previous travel planning efforts. And then what happens if we do see an outbreak in our workplaces going forward, things that we need to be considering. We'll take a closer look at some potential controls and such in a bit, but do we look at forcing employees to work from home, shutting offices down for a while to kind of contain it? Do we have a continuation of business plan? We want to take a look at that. Does it address what happens if a business or an office is affected by a disease, an infectious disease like this? If it doesn't, we'll talk about some guidance here in a little bit. things that we might want to implement in that continuation of business plan, the contingency plan. So let's talk about some specific OSHA rules that we might have to encounter. All of these are important considerations in the workplace, but what about specific OSHA compliance obligations? Take a look at some of this now. Employers, we're going to have to evaluate if there are any regulatory obligations as we put together our response and operating procedures for COVID or other infectious diseases. And recognize that even if we implement certain policies or practices that might be voluntary, we have to be mindful of, in some cases, even voluntary types of actions could have regulatory obligation, as we'll see. So things that we'll need to consider. Now, that being said, there is no OSHA rule that specifically deals with COVID-19 or certain kind of broad-reaching infectious disease protection. There's one I'll talk about in just a moment, but none specific to COVID-19. However, OSHA has repeatedly said that even when we're dealing with infectious disease, employers governed by the OSHA Act are still going to be subject to the general duty clause of the law, which requires employers to furnish a workplace that's free from recognized hazards that can result in death or substantial physical harm. And so widespread infectious diseases could certainly fall into that recognizable category, especially if they've been elevated to pandemic status. And so we still have some obligations as we look at protecting our employees from the spread of and effects of these infectious diseases in the workplace. Now, there is an OSHA standard in 29 CFR 1910 called the Bloodborne Pathogens Standard, 1910.1030/1030. Now, bloodborne pathogen standard is intended to protect employees from workplace exposures to blood or other potentially infectious substances, and centers typically around viruses that spread through that means, blood. So HIV, hepatitis B, those are the particular viruses commonly focused on that. COVID-19 is transmitted respiratory system, so it's not subject to the specific bloodborne pathogen standard. OSHA has affirmed that. However, they do say that that rule does provide us with a framework that we can build protections for our employees associated with infectious diseases like COVID-19. So I want to take just a couple of moments and talk a little bit about the bloodborne pathogens standard, just so we can understand how that framework could potentially be applied here. And if you're familiar with the standard, you know that it's going to require employers who have employees working with blood or other potentially infectious substances to protect their employees through universal precautions, through various engineering or administrative controls, as well as PPE. And universal precautions in the bloodborne pathogen standard basically are the employer is to presume that all human blood and certain human bodily fluids are infected with HIV or hepatitis B virus and potentially other bloodborne-based pathogens. Again, COVID-19 is a respiratory-based pathogen. So, but the idea here is that the practices that we implement, the controls and the PPE, are to protect employees from all exposure to blood, so not just those that actually have the virus. So the framework then is, as we think about things like coronavirus, we can take those same type of universal precaution approaches, assume that surfaces are contaminated with the SARS-CoV-2 virus, assume a person is a carrier of the virus, and so implementing protocol to minimize that. Now, within the bloodborne pathogen standard, it reminds us, just as the general PPE standards go, that we can't just jump to PPE. That's always the last resort. PPE might be an important step in this process, but we should always be thinking about engineering and administrative controls first. So it's at the very bottom of our considerations. And so as we think about engineering and administrative controls, there's a number of different things that we do, and they might vary from one workplace to another. What environmental or engineering approaches a hospital is going to implement, it's going to be a lot different from a manufacturing setting or a warehouse setting or an office setting. So understand that what I throw out in terms of examples are merely that. They're examples of engineering and administrative controls for various workplaces. Engineering controls are the types of controls that we implement that are not going to be employee dependent. So they work outside of the employee. So you see examples like, high efficiency filtration systems if we're in a work environment where there's a lot of the potential for aerosols to contain the virus. Do we have ventilation and filtration systems that we can implement that pull that air out more quickly or create a negative pressure situation, so we're not pushing these out of a controlled area. Could even be physical barriers. You probably started to see these in some of, if you've been able to get out in some of your retail establishments with, sneeze guards at cashiers or the supermarket or wherever you might be going. A lot of businesses establishing, or directing everybody to drive through our customer service remote pickup lockers, right? So you can go to certain retail establishments, order online, and you don't have that physical contact. So various types of engineering controls that we potentially implement. Administrative controls, again, before PPE, but administrative controls are going to be connected to employee behavior or action. All right. So still something to consider if we can't do engineering controls. Examples could be employees working from home. Again, all the various issues associated with work from home. We still need to make sure they have a safe environment to do that work. We need to make sure, obviously, that they have the infrastructure, the equipment, and do we have access to our company network systems and such. But it is an administrative control. Replacing face-to-face meetings with one more video meeting, right? Discontinuing non-essential travel, which we talked about a few slides back, especially if we're talking about travel that might send our employees into hot zones or employees that might be higher risk. So establishing those. In the manufacturing setting, sometimes administrative controls to kind of spread employees out so they're not on top of each other. Some employee workplaces have gone to extending shifts. So we have multiple shifts where we might normally have been able to do our production during the day shift, but requires a lot of employees. Can we reduce that multiple shifts? Obviously, some added logistics, but maybe by doing so, we can spread our employees out so they're not close in with each other. Continuous education and communication on employee behavior. So increasing the signage of washing our hands or reminders to wash our hands, communication on how to clean their work surfaces and such, and maybe increasing our procedures and timelines for cleaning our workplaces. Again, we've talked about the encouraging employees to stay home when sick a couple of times. If we can't eliminate the hazard in our context here of employee exposure to COVID or SARS-CoV-2, if you will, in the workplace, and we still need to go to PPE, and we make that decision, well, there are some standards for that in 1910, and general obligations are employees have to assess the hazards in the workplace, identify and provide the appropriate PPE based on the hazards. We are obligated to train our employees in the use and care and maintenance of that PPE, depending on what it is. And there might be a requirement for periodic evaluation and updating to our program. In some cases, there's documentation that goes along with this. And we're talking about diseases like COVID-19. If we get to PPE, respiratory protection, obviously, is probably going to be the area that we're going to be centering around in many workplaces. If our engineering and administrative controls alone won't prevent the atmospheric contamination, we might need to move into respiratory protection. And there's a specific standard in 1910, Section 134, that if the employer has determined that respiratory protection is required, and again, that could be in this context, then we have to develop a written respiratory protection program potentially for that. That's kind of a default general requirement. And that program has to have in that document the procedures that our workplace takes in terms of selecting the right types of respirators. And there are all sorts of respirators, from those that just filter the existing atmosphere to those that provide a clean atmosphere. How do we, in our workplace, select the right ones for our employees? Assuring medical evaluations and fit testing. If a respirator does not fit properly, it's not going to provide the adequate respiratory protection. And respirators themselves, by restricting in some way, provide a medical strain, a strain to the employee, which could create its own medical hazard. So medical evaluations are procedures for how we properly use, put on, take off, maintain, inspect, care for the specific PPE. All of that has to be part of our written respiratory protection program. If we're talking about supplied air outside of the atmosphere, we'll have to document how we assure the air quality of that supplied air, so it's not going to make our employees sick, and how we're going to train our employees and assure that our respiratory program is effective. Okay. In terms of selecting respirators, this comes from the respirator standard, not specific to COVID, but factors to consider. Is that when we're determining what respirator to use, again, after engineering administrative controls have been evaluated and factored, the specific respirators are going to be based on a number of factors. What are the contaminants that we're dealing with? Are we dealing with aerosolized viruses, or are we dealing with a toxic chemical substance? What's the form of the contaminant? What's the degree of toxicity of that contaminant? And what's the concentration? How much of it is in the air that the employee would normally be breathing without that protection? All of those are going to factor into what types of PPE might be appropriate. Generally speaking, if we're talking about infectious disease transmission by way of the air, like a SARS-CoV-2 virus would be typically transmitted, then generally speaking, N95 type respirators are the most often used controls. But as I mentioned, that even N95 respirators, if they are not properly fit for the employee, aren't going to provide the protection that we're looking to achieve. They do come in various models. They come in various sizes. Each manufacturer has its own criteria for how you determine proper fit. So as you're evaluating, if you've determined that this is important in your workplace, it's necessary, right? If we've determined that the use of this is necessary to protect our employees from this respiratory hazard, then we need to make sure that we evaluate the manufacturer specifications and instructions, especially with regards to size and fit testing. Medical evaluations, as I talked about, have to be done by a licensed healthcare professional. And there's a questionnaire in the standard, Appendix C, that has to be completed by the employee. We want to make sure we're not adding a new hazard to the employee. Again, that's all if we've determined that respirators are mandatory, that they're essential, they need to be done to protect the employees. There are some cases, way back in the beginning, I said even voluntary decisions could have regulatory impact. In the case of respirators, there could be a work environment where we've determined respirator is not required. We've either engineered out or administered out the hazard, but we're going to allow employees to wear respirators. It's not necessary, but if it makes them feel more comfortable, we'll allow it. Even in those situations, the OSHA standard says that if employers allow employees to wear them voluntarily, there are still going to be certain elements of the written program that we have to develop. Notice what's included: medical evaluations, maintenance, and care. Because if I don't properly clean and care for the respirator, again, it could create a hazard to the employee. And we already talked about the medical evaluations. Now, fit testing wouldn't be required if we've determined it's not necessary to wear the respirator. Okay. Now, even with voluntary use of respirators, employers are required to imply employees with some written information. There's actually a copy of this appendix at the back of your compliance notebook, so you have that if you want to photocopy and distribute if you fall into this category. But the idea is that OSHA wants employees to know, hey, you're wearing a respirator. You don't have to, but there still are potential health effects that you want to be mindful of if you're going to be using this. Your employer is determined you don't need to, but you should be aware of some of the issues associated with just the general use of respirators. Now, when it comes to filtering face pieces like N95 respirators, good news is if we determine it's voluntary, again, I'm emphasizing you've determined it's voluntary, you don't have to have a written respiratory protection program. However, you still have to provide that Appendix D to the employees. So still is an obligation, but we don't have to have that written documentation about medical evaluations and use and care if all we're talking about are these N95 respirators, okay? But we do have to provide them with a copy of that Appendix D. Now, I want to talk a little bit about surgical masks. And there's some guidance that's out there now. In fact, in some cases, some government entities are requiring or encouraging the public to wear some sort of face mask if they go out in public. One thing I want you to note is that when we talk about these face masks, sometimes called surgical masks or procedure masks, we're not talking about N95 types of masks, right? Even surgical N95 masks, that's PPE. We're just talking about these type of procedure masks. One thing that they emphasize is that that is not PPE. That is not protecting the wearer from exposure to these aerosol forms of the virus. It's actually to protect others from this person who might be a carrier of this, right? So it's not PPE, therefore it's not part of the standard we talked about. But again, we need to make sure our employees understand, if we're allowing these, that this is not from a standpoint of this is to protect them. It's to protect others from themselves, from that employee who might be a carrier. Right? One of the things that OSHA has talked about with the CDC in recent weeks is it's not a regulatory requirement, but certainly could be a good management practice. The idea of an employer developing an infectious disease preparedness and response plan. Again, good management practice. There is guidance available from OSHA and CDC. It's currently focused on COVID-19 because that's what we're dealing with, but it can be adaptable to other infectious diseases. And now some companies already have something like this. Check with your with your company first, but here is some of the elements of this that OSHA and CDC recommend is that we have a a procedure for how do we prevent infectious disease spread. We've talked about all that already. So it's really just simply what is our current practice from what we've talked about and putting that down. What policies and procedures do we have for promptly identifying and isolating sick employees and others in the workplace? What sort of flexibilities do we have for our employees? That could be work from home, right? It could be special sick days under certain circumstances and such. So what sort of flexibilities do we have? And ultimately also what sort of workplace controls? Now, what you put together in the specifics are going to vary depending on the risks that you might see in your workplace. Now, if you looked at this guidance, OSHA and CDC have broken down infectious disease exposure risk to 4 categories. You see them there from very high to low, which would be a cautious area. As we look at classifying the level, it's going to depend where your workplace falls from very high to low and what you're doing, right? Are you a healthcare setting? Are you a manufacturing setting? Are you a public setting where you're exposed to a lot of folks in the public that are uncertain in terms of their whether they have the disease or carrying an infectious disease? Are they going to be close-in types of work settings where employees or the public is going to be within 6 feet of our employees? So in this case, COVID-19 we're talking about. Do we have requirements for our employees to be exposed to infected folks or suspected infected folks for a long period of time? That can impact how you write this. Just quickly running through the various risk levels. Very high risk workplaces are those where there's an extremely high potential that our employee is going to be exposed to either known or suspected sources of infection. So you can probably think of these folks right off the bat. Healthcare workers, especially those that are doing various aerosol generating procedures. That includes things like intubations, cough induction procedures, bronchoscopes, dental procedures even potentially, right? Healthcare laboratory personnel that are handling specimens, morgue workers, right? These are folks who are very likely to be exposed to employee or others that are known or suspected to. High risk, they have a high potential. It's not as high as the very high, right? So you could have healthcare workers that aren't doing aerosol procedures, medical transport workers, mortuary workers, right? So still very significant, but a lower degree of risk. And the medium, those who might have close in or frequent contact with people. You could see this in a manufacturing setting, right, where you have a lot of folks working on the floor that are close together. Here's some other examples. Ongoing, if it's not an ongoing community transmission, they might have frequent contact with travelers that are coming from areas. If our workplace is within a community that's experiencing high rates of infectious disease right now, again, it could be that we have contact with the public in that area. So supermarkets, retail establishments, restaurants, and such. Right. Low exposure, here we know it's minimal, but there still is the risk. We might be in contact with people that we don't suspect, but they could potentially be infected with an infectious disease, right? So the types of actions you take are going to be based on what level of risk your workplace falls into there. And again, we've talked about a number of those types of controls and responses. One OSHA standard I want to talk about is the injury illness record keeping standard as we deal with infectious disease. This is a requirement that some workplaces, not everybody, if you fall within certain workplaces, have to keep records, logs of employee work-related injuries and illnesses, the 300 log that you'd be familiar with. Now, those of you familiar with the standard, one of the things that OSHA has said is that workplace exposure to the common cold or flu is actually exempt from record keeping. However, COVID-19 and as an infectious disease, if it's a covered employer and is workplace related and results in one of the recordable incidents, would be something that has to be recorded under 29 CFR 1904. So it doesn't fall under the flu or common cold exclusion, right? Now, one of the challenges in dealing with these non-excluded infectious diseases like COVID-19 is determining whether or not it's work-related. We only have to record this incident if, in fact, it is work-related. In other words, the exposure was work-related, it was within the work environment, and so that adds some added degree of difficulty for the employer, but something that we need to be aware of as we're trying to address OSHA compliance here. Now, it gets even more complicated if you have travelers that if something happens, exposure happens while traveling, that's not necessarily work-related, but once they've reestablished themselves at that endpoint, certain activities could potentially be part of their work environment. So again, so here we're talking about some sort of illness resulted from workplace exposure to something like COVID-19. It's challenging, right? If we do, again, we have to evaluate their work duties and environment, decide whether or not one or more of the events or exposures was caused or contributed to this, or the workplace activity or exposure significantly aggravated a pre-existing condition. These are all things that OSHA talks about in their general instructions for record keeping associated with illness in the workplace. And that, as we said, could include COVID-19. Now, I say that, but also want to mention that this is an evolving thing, and every day OSHA is publishing additional guidance and policies. There is a new enforcement memo, came out April 10th, so just a couple of days ago. And what this is doing is addressing this record-keeping obligation specific to employers that are in areas where there's an ongoing community transmission, right? And what that memo says is that if I'm an employer in one of these areas, and I'm specifically in the healthcare, emergency responder, correctional institution, I still have the obligation to determine work-relatedness if I have an employee that has some sort of recordable injury or illness associated with COVID-19. I still have to determine, hey, was that COVID-19 illness that would normally be recordable work-related, right? I still have to do that. What they're saying is that, again, if an employer is in one of these communities where there is this higher level of disease going on, then I don't need to, right, this is temporary essentially, undergo that work-relatedness determination unless there's objective evidence that we know the employee's COVID-19 illness was work-related or the evidence was reasonably available. So unless the evidence is objective or reasonably available, and we're not in healthcare or the other industries, and our community, this is the key, bring that slide back up, where there's an ongoing community transmission, then I'm accepted from the workplace determination. Okay, which does seem to imply that if the conditions change and we're no longer identified as one of those ongoing community transmission areas, but we have an incident pop up, we might still have to record that if, in fact, it's determined to be work-related. Right? All right. So there's some temporary relief that we see here. Again, when we're dealing with the standard, there is also a reporting standard, a telephonic reporting standard that applies to any employer, unlike the 300 log, which is limited to certain workplaces, where we have death of one or more employees or hospitalization of one or more employees due to a work-related incident. Again, there is no exception right now for the reporting obligations. If you have determined that you have a workplace incident that results in death or hospitalization associated with COVID-19, there's nothing in that April 10th memo that excludes us from the reporting obligations, just the 300 log if we're in certain work settings. Now, one thing I do want to point out here, last content slide, is that there are some states, so I said OSHA does not have specific rules related to COVID-19 or infectious disease transmission like COVID-19. There are some states that might have specific programs. This is just one example. In California, there actually is an aerosol transmissible disease standard. Now, if you were to take a look at that Title VIII rule, you'll see that it does target healthcare industries. So if you're, a hospital and you're doing certain aerosol type operations, we talked about intubation and such, there actually is a workplace safety standard for those employees, right? So you do want to be familiar with any state-specific workplace rules. And about half the states have their own workplace safety programs. OSHA is not the only game in town. So that being the case, we'll tackle any questions in the remaining minutes and see what we can do to provide some clarity if possible. Let's see, one question was, is there any evidence that hotter temperatures or higher humidity affect the virus? That is a great question. I am not a infectious disease expert. I don't know all the subtle nuances of the survivability of the virus outside of a host. I have heard things where some folks have talked about higher temperatures or humidity. Folks have talked about that in relationship to numbers of cases in certain regions of the country as possibly having a factor. I would be afraid to speculate on that. I would direct you to either the WHO websites or CDC websites to see if there's any specific information relative to that. I would go to those types of primary sources before I would speculate. And here's one thing I would say. If you look at even the CDC website or the OSHA website in the last couple of weeks, it's changing so rapidly. There's so much, because this is a novel virus. In other words, as we said earlier, it's not a virus that has previously been in humans. I think there's a lot that we're learning about the disease that we never knew before. So this is a steep learning curve. And at this point, the best I could say is possibly, but I wouldn't necessarily bank on it. I would take the same approach in terms of precautions that we've been discussing, no matter what latitude your workplace is, at least for the foreseeable future. Another question was a bleach solution that had 5 tablespoons bleach to 1/3 cup. Yes, that comes from the CDC guidelines. That would, and you're asking, that would be 50% bleach solution. Is that the recommended concentration? I honestly don't remember off the top of my head whether or not the CDC mentioned the concentration. I think they were thinking of, barring going back to the CDC website, the idea is that you have access to, your bleach solution, like your, not to name any brands, but that you would normally use in, could buy in the retail stores and grocery stores. I don't know what the concentration is of those bleach solutions, if they're 50% or not. So, yeah, I would say go back to the CDC. That ratio was from CDC, so check the CDC website for more specifics if they do clarify that. So another question, and this is regarding voluntary use of respirators. Do we still need to provide the medical questionnaire for voluntary use? The answer to that is depends on what respirator you're talking about, right? If you're talking about filtering face pieces, like an N95 mask, then the answer is no. I would not have to do the medical evaluation, so therefore the medical questionnaire is not required. However, if I were requiring employees to use some other type of half-face or full-face cartridge respirator, for example, or a supplied air respirator, then I do have to go through the medical questionnaire and the medical evaluation. So, so even though the use of, for example, a half-face respirator with filtering a HEPA type of cartridge on there, even if I say that's voluntary, there still is a medical risk associated with that, and so medical evaluations are necessary. The only exception to medical evaluations are for filtering face pieces, like N95s. Okay. Another N95 question. We've provided an N95 mask to employees, optional. Okay, so voluntary. We now need to provide a copy of the standard and also medical exam. So it's kind of related to that. No, the only thing that you have to provide, so if it's N95 type of respirator, filtering face piece, the only obligation you have is to provide them with a copy of Appendix D. It's not the standard, Appendix D, what you see at the end of your compliance notebook here. And as I mentioned in the previous question, they don't need a medical examination for voluntary use of filtering face pieces and N95 masks. Let's see. Somebody's asking the difference between an N95 mask and a KN95 mask. Off the top of my head, I don't know. Certainly it'd be something that I would need to dig a little further into as to whether or not a KN95 mask be something that would be NIOSH type approved and such, and would be considered something that would have to be properly fit and so on. I'm not familiar with them off the top of my head, unfortunately. Another question, do we know at this point the source of this virus? Is it natural or created in the lab? I don't know. I honestly cannot say, and I think due to the fluidity of everything that is ongoing, that that may yet be decided. But it's here, wherever its origin was. It has jumped to humans, and so now we're dealing with it. Question, I think, related to the record-keeping standard. How can anyone really determine the work-relatedness of a viral infection like COVID-19? Well, obviously, some workplaces, it's going to be easier than others, right? Like healthcare, certainly be a lot easier to make some work-relatedness determinations for an employee in that setting as being a cause of a recordable illness under 1904. Others, it is difficult, yeah, and OSHA does not specifically provide guidance on determining work-relatedness to COVID-19. And so therefore it kind of defaults to any general guidance that OSHA has previously put out on any sort of illness as to whether or not it could be determined or reasonably determined to be a work-related event. I suppose, again, the frustration and the very rapid nature of this, part of the reasons why OSHA has excluded some workplaces from having to figure that out if they have a lot of employees who are having recordable types of effects from COVID-19 illness, saying, well, if that workplace is in one of those active communities, I don't have to worry about doing the work-relatedness determination. But yeah, there isn't any specific guidance other than what would normally be in place for anything, any illness that would be evaluated by an employer for work-relatedness under 1904. And let's see, in a university setting, would people who interact with the public need sneeze guards installed? Yeah, that's a great question and kind of gets back to that evaluating the level of risk and what types of engineering controls are appropriate for that. So what I would likely say is, and if you get a hold of the, go back to the slides here, bring that up, it's probably likely that, again, you're going to have to evaluate this specifically yourself, but very likely that you might be identifying your employees in either a low exposure risk category or possibly a medium risk category. If they have a lot of close-in contact and we know the area is not actively dealing with community transmission, then the issue is, are they going to have exposure folks that are coming from those areas? That would probably pull it into a medium category. If not, then it might be low exposure. And that being the case, earlier we talked about various types of engineering and administrative controls. The guidance that the CDC and OSHA put together on the risk planning, they actually go into what are good examples of engineering controls and such for low risk and medium risk and high risk and very high categories. So you would want to take a look specifically. I'm seeing if I can identify that very quickly and not without great effort here. So I would direct you to the here you go, engineering controls for lower risk. Some of the general stuff they talked about, but here they talk about additional engineering controls. Monitoring public, it's administrative, collaborating with workers. So, yeah, it's difficult to read this on the fly and answer the question, but I would defer you to that. The title of it is, and you can probably do a search on OSHA's website on COVID, Guidance on Preparing Workplaces for COVID-19. Again, I mentioned this as kind of being a good management practice. It's written around COVID-19, but there's a lot of good structure in here that an employer could build regardless of the infectious disease. So, 2019, 2020, we're dealing with COVID. If in 5 years from now we're dealing with another a pandemic type of situation, we can adapt it for those circumstances. But yeah, I would send you back to that specifically. I think we have time for one more question, and so this question, I think, is dealing with surgical masks. If an employer is giving out surgical-type masks to all employees, but employees decide to bring their own respirators, half mask, elastomeric, does the employer have to follow the standard for that employee? So I think what you're getting at is you're allowing them or giving them these surgical masks, which we've said OSHA doesn't view those as PPE, but the employee wants to bring in their own half-face cartridge respirator. That would be a scenario, if you're going to allow them to do that, that's called voluntary use. And so based on the respirator that you introduced in that question, that would obligate you as an employer to comply with the written respiratory protection program requirements for voluntary use. And in the case of those half-face elastomeric respirators, that would mean you'd still have to do the medical evaluations, and you'd have to provide them with the clean care stuff, and they'd have to have a copy of Appendix D. So there were a couple of questions that we did not get a chance to get to for time. We'll take a look, and maybe we can put together some frequently asked questions or responses and get those out to everybody. And so time being short here, I'm going to shut it down. Thank you again for your participation today. A lot of stuff to cover in an hour and a half, but hopefully as you kind of marry what you're getting out in the news streams with looking at some of OSHA's standards and trying to put together a good system for your workplaces to protect your employees, hopefully this helps kind of bring those two together as you think through these issues. As I said, a lot of us right now are dealing with shut down workplaces or remote workplaces, but as we slowly come back to normal, these are things that we're still going to have to address for the foreseeable future, at the very least probably until there's serological testing for antibodies and maybe even vaccines. The likelihood that exposure to this virus is still out there for our employees. So hopefully this has helped you out and gives you some stuff to munch on as we try and tackle this and ensure that we're doing everything that we're obligated to under these workplace safety provisions as well. So on behalf of Roger and the rest of our team here at Lion, again, thank you so much for spending some time with us this afternoon. I do want to extend to you best wishes that you and your employees remain safe and healthy and get through this pandemic with minimal impact. Thank you, everybody. Take care.